Good morning, everyone. Thank you so much for coming today. We're so excited to have a conversation, and thank you all for being so understanding. I'm just saying that in advance. I apologize for sending you guys the wrong document for 10 days to review. So we will jump in kind of level setting and all of that. Okay, thank you. Okay, I think we're good. So I want to just say thank you guys again. I just want to kind of make sure I explain this as well, that, as you all know, we've been doing this work now since January 2024, and we've really been listening to everything that you all have shared with us. And I feel like a lot of progress, it seems, has been made. I definitely would want to hear from you all as to whether you feel the same, obviously, and what progress you'd like to see, so that we're held accountable. I wanted to let you know that also when I started this, I shared with you all that our team really believes in and communicated from the beginning that we want to see, we don't believe in planning and then not having another opportunity for implementation support, because that's what happens a lot of times, is that people get all of these great ideas from you all, and then they say, here you go, this is the plan, good luck. That's what we didn't want to do. And so I know I cannot guarantee funding from MFH. And I know that these times are really strange. And so I wanted to mention that. But at the same time, I still plan for us to be able to, I want to plan for us to be able to get more funding. So I just want us to be as clear as possible about what will work. And that's what this meeting is for us to just kind of talk through some of those things. There are things we've proposed based on what we've heard from you all, but there are also things that we know still need to take place and we may not have considered. And so we really see you all as the experts. So thank you for being here for that. I think from there, are there any questions, any thoughts before we start as well? No? Okay. I'll jump into the agenda. Um, I see people in the chat, so thank you all. I'm going to jump into the agenda and I will ask Tanisha, do you mind sharing the agenda as well as the documents in the chat, just so everyone can easily click on them if they didn't get to in the email, since that was
Will
sent out?
do.
Okay, thank you so much. That was just sent out this morning, so I want to be sensitive to that. But I will go ahead and I'm going to share this agenda, and then we'll jump in to everything from there. Okay. So I wanted to do a quick review with you all. Again, I know you all are just seeing this document, so that's why I said we'll decide how to proceed from here, because you all haven't had the time that I thought you did to actually look at it, digest the information, share your, thoughts about everything. And so I want to acknowledge that, but I will still at least make sure that we look at it real quick. I'm not going to take you through all of this. This is kind of just background stuff. But what I will highlight here is that we really didn't have a lot of role representation from the beginning. And that was our major challenge through this work, is just us being able to actually connect with people in the different regions across the state of Missouri. And that's something we were intentional about doing. And so I'm really grateful, because like IHN has connected us to a lot of people, as well as Missouri Extension. And so now we do have a ton of representation. It's just that it's towards the end of the project, but the current contract. But I'm really grateful, because I feel like we can't move forward with decisions if we don't have the right people in the room. That's just not, it's not fair for us to make decisions based on what the St. Louis region thinks, because that's not the majority of Missouri. So I'm excited about that, and I'm thankful for the hard work that our team has done to make this happen. I'm thankful for partners like IHN, who believe in the work that we're doing, and they're like, whatever you need us to do, we'll do it. And they got us in front of their care. They got us in front of their administrative, like executive level folks, but they also got us in front of their transitions of care group that really have been very helpful, because they have voices at all levels of this work, which is what we want. And then again, University of Missouri Extension has, they've given us access to like around almost 100 people across these 6 regions. So we've learned a lot about things like in the rural community. There are already established community health coalitions, as well as what they call extension councils, which the community health coalitions have a lot of representation from people that are on the ground doing this work across sectors, which you guys know is important for us. It's not just breast health operating in silo, it's us looking at those social determinants of health. So housing and education, employment, all of that. They even have banks there for some of them, but these extension councils also have the political aspect of things. We need the policymakers there as well. So that's been, that's really helpful. So I just wanted to make sure that we, called that out. So that's something that's really helped us along the way, in addition to all of your voices and your feedback and just hearing about the challenges. I do love that though we were working towards Show Me Healthy Women, lowering the age, and we didn't necessarily do that, it's been lowered. And so that's one of the things I know was most important. And we kept hearing from you all. And it's like, how do we access this information? We were able to bring that to you all. And also I want to update that Dr. Keisha Wyndham at PCAD is in communication with them, and they have new materials and new information to reflect that they're going to be making her aware of. And so once she has that, she's going to share that with us so that we can give that to you all as well. So I just want to acknowledge that, because those partnerships really help us. We can't reach everyone. And so this just recaps our phase that we already have been through. Then we also want to make sure that moving forward, we're intentional about actually getting into the region. So you guys might remember, I'm not going to have you all go through all of this, but you all may remember that we said we were going to establish regional breast health coalitions. That would kind of be an extension of this statewide one. However, through the conversations that we recently had with the Missouri Extension folks, we learned that there are already those existing community health coalitions. So it doesn't make sense to start our own thing. It makes sense to join the work that they're already doing and make sure that this is something that's very present there. So I just wanted to share that as well. I think that's important. And so as we move forward, what we would like to do, and again, I say I'd like to do because it sounds good in our heads, but you all may say it doesn't make sense, is that we want to make sure that we have facilitative leadership. So we want to make sure that you all are empowered to really not only share your voices, but also take ownership of this. And so we want to take an approach that looks at that. And the 7 principles of that are sharing and inspiring vision. We also know we need results. We need to make sure that the process that's put in place really makes sense for what is going on in each of your regions. We don't want to just put something in place to say that we did it. We want to make sure that it's actually going to be operational. And then also it's about relationships. So it's about not only our relationship with you all, but your relationship in the community and your knowledge that you have of the communities that you work in and you serve. And so we want to make sure that that's at the top of this, and that's something you all are bringing to the conversations. We want to seek maximum appropriate involvement. And so that is us not only wanting you all engaged, we want to make sure we have the right people at the table. You might say, hey, we don't have this person and we know that they're extremely influential, they're knowledgeable, we need to engage them. And it doesn't matter that they don't work for a certain organization. If they do, that's great. But we really also want people that are from the community that just have invaluable voices because of their lived experiences. And we won't know who those people are without you. Design pathways to action. So we want to make sure that whatever we're talking about, we're actually able to put into action and make it happen. We want to make sure we're all in agreement. We're going to provide support also, because sometimes you guys may be ready to lead or want to lead, but also it's like, well, I need help understanding how I can actually do this and be effective. You also may teach us some things about how to be effective. So, and other coalition members. So I want to acknowledge that too. And then we also want to make sure we're celebrating. So that's that. So then there's also a psychological component that people have, one person has called out in his work. And I think that that's important as well. So the psychological aspect of this, how it impacts how the work impacts us and how what's going on in our community impacts us is huge. And we can't ignore that. Sometimes people say feelings aren't facts, but I do think feelings are relevant because it's real based on what you're experiencing. And as I think about the current climate it's even more of it's even more important. So again, I won't go through all of this stuff because it's a lot. I do invite you all to look at the document and then provide us feedback. And we also can reconvene once you've had a chance to, if you would like to do that. We do want to make sure that when we're looking at one key thing is community participatory budgeting. And what I mean by that is that you all as coalition members get to decide where the money goes. So when we're looking at capacity building and training, I want you all to say, hey, in my region, this is what we need. Based on what I'm seeing, we need you all to provide training in this area or capacity building, give it, build up the infrastructure here. And that will guide us as to what's offered. So we have a menu of options, but it's really about what you all feel is necessary. And so we want you to decide. We'll have, I don't know what the amount will be yet because we're still waiting for MFH to review things and let us know what funding they have, if any, but we'd like them to tell us. Did I hear someone say something? I'm sorry. No, okay, we're good. I want to make sure that when we do get that money, because I'm going to claim that we're going to get it, but when we do get that money, you all are able to have this pot of money to choose from that will allocate evenly across the 6 regions. And you can let us know, this is what I'd like us to focus on. But I'd like to hear that from you guys up front. So we're going to ask that today too. But just wanted to call that out. I think from there, I think that's it. I think the last thing I'll show you all, and then we'll move on, is because this is an extensive document, as you can see, is that there's this timeline that I want to draw your attention to as well. We didn't get to do everything. So you guys know that we're going to be finalizing this contract by having some plans in place based on what you all have shared with us. But I do feel like in the next contract, we're still going to need to come back to that. We may need to adjust. Again, things are changing constantly. So I wanted us to, our team talked about this extensively, and we really wanted to make sure that there was an opportunity to still review that, make some additional changes, and just really operate from something that makes sense at that time. And then we're going to continue to look at policies and all of that. We're going to join those community health coalitions. And if there are other spaces you all tell us we need to be in, we will do our best to do that as well, because that's important. And just really, that's where, even if you guys give us ideas today, which I hope you do, that's where we will finally start saying, okay, this is exactly what our region needs. Like, now that we are in this work, this is what we need. And constantly refining the logic models, the evaluation, all of that. So I'm going to stop there as far as sharing. Are there any thoughts at this point? Oh, sorry, there's a question here. Yes, okay, the regions. Let me pull up the, or Tanisha, do you want to pull up the website? It's up to you, whatever you want to do.
Sure, I can pull it up.
Okay, that'd be great. So, yeah, then we can show you all the regions that we have. So good question. Sorry about that, because there are people that are newer to this conversation. I didn't think about that.
Are you seeing
Okay.
this?
Yes. Can you make it a little bigger for us? I don't know if that's. Okay, I think that's. So, oh, good question. So, great question. So these are the regions, these are the cities represented, and, or excuse me, counties represented. And we also know, at least for the people that are from the extension council, they actually, some of them overlap into more than one region. So I want to acknowledge that we are aware of that, and we've captured that for that space. And also, as far as who will lead the regional conversations, that's actually what we want you all to tell us. So that's something that we can't make a decision on. We were wanting to bring in regional liaisons, and so we put the call out for that. But at the same time, we didn't have the representation for the 6 regions. So while we did get some responses, it was from people that were in the St. Louis area, which we need that region too. But we didn't have enough people to be able to say, yes, we're going to move forward with that. So what we are looking to do in the second contract is have you all identify, based on what you're seeing then, who is best in your community to lead the conversation. We're gonna bring the information, but you all would select the leaders, and those people would communicate to us on a regular basis, letting us know what's going on the ground, anything that's changed, what else they would need us to do to provide support, and then we'd go from there. So I hope that answers the question. Does that answer it? I know we had Chiquita ask the question, and I don't know if it was a different person too. Oh, is it Besmeen? Besmeen, am I saying that correctly?
Yes, that's really correct.
Okay.
Is it possible for us to get an email of this regional map?
Definitely. It's also on our website that you see there. And we can
Okay,
put that in the let me put that in the chat as well.
right. I
Tanisha
saw
put it.
the website and the region, so thank you. That's the information I was wondering about.
No, I'm so glad that you oh, Tanisha already put it in there actually. Yes. So she put it in there about 5 minutes ago. Yes, that's you're absolutely correct. We should start every meeting with that information just to make sure everybody knows. So thank you for calling that out. I appreciate it. Okay, there we go. All right, Tanisha, thank you. So I think we're going to also jump into some questions. First, I want to ask, does anyone have anything else that they want to share before we do that? No? So we're gonna proceed with the questions. Like we're gonna go with the agenda the way that it is now. Unless anyone wants us to switch things up and talk about something beforehand, we can, do that as well. But if you feel like something else should be moved to the top, we can totally do that. But at this point, okay, I'm pulling up my document. I want to ask you guys questions about implementation. Again, I know you haven't looked at the document extensively yet because you haven't had the time. But I wanted to say that as we're looking to get more into the regions and join conversations that are already being had, um, are there ways that you feel like we should engage? So are there certain groups that you feel like we need to be a part of that already exist in your area that are already focused on? It'd be great if it's breast health, but it doesn't have to be that. They're focused on health at all. Um, if there are, please let us know that. Um, is there anything like that that you all are thinking of as we look into this work? Nobody? I can call on people. I'm gonna call on people if I need to, because I want to make sure that we definitely get these questions answered.
Hi, this is Sarah. I'm from Siteman Cancer Center in WashU, but also the Missouri Cancer Consortium. We're gearing up to be working on the update for the State Cancer Action Plan this next year. And so we are going to be pulling together work groups around prevention and control, screening and early detection, and then survivorship. And we want each of these work groups to help us understand really what are the priorities, what improvements can we make upon last year's state cancer action plan. So this would be kind of that like higher level planning and organizing. So I can definitely share whenever those work groups start meeting, I can share it with this group and just make sure that we really have the voice of this group at some of those upcoming meetings.
Thank you so much. I really appreciate that. Thank you for being here. Thank you for your partnership as well, because you all might remember that we brought her on a few months ago just to introduce all that the Missouri Cancer Consortium is doing and see how we can collaborate. And I just think that you were super collaborative and interested in working with us and making sure that our coalition members' voices were heard. And so we're excited about that.
I think especially with writing the plan, so often we have people from outside who help us understand the plan, or we take from other people's plans, whereas we have so many smart people on this committee. I would rather get our voice because we're the only ones who really know what's happening here in Missouri. And there could be some easy fixes to our existing plan just to make it more efficient, more strategic, and just aligning. I think right now more than ever, we need to just align resources.
I love that. Yeah, I agree. I agree. Collaboration it's always been important and it's even more so now. Like we're not going to survive without each other. Dr. Hunter Green?
Yes, presently there is a group of individuals that are being trained through Sighton Cancer Center on cancer with Lincoln University. And they are in multiple counties. I think they will be ideal for sitting on the platform to share. And when doing that, and everyone knows Southeast Missouri, aka Boot Hill, is a very large area, and we can use those resources when they're doing their presentation to recruit and get the word out to make the initiative stronger. And there are other, different things that are going on in the Southeast Missouri area as well. So we could talk about that later. But I did want you to know there is currently a group being trained on cancer who will be getting their, feet on the ground, and that would be excellent.
Love that.
Thank you.
you. I always get chills when I get excited. So thank you. That's wonderful.
Mhm.
We'd love to be invited to the table. So we thank you. I'm just trying to make sure. Go ahead, please.
Good morning, everybody. Jesse Davis, Integrated Health Network. In the chat, I was mentioning the TLC task force. So I just wanted to explain a little bit what that was. So quarterly, we convene a group across the region. We have multiple hospitals represented, multiple associations, and clinical groups represented there. Care coordination, case managers, CHWs, hospital leaders, leaders from the federally qualified health centers as well. And we meet quarterly to discuss issues across the region as it relates to transitioning across care environments, like from inpatient to ER to primary care, getting your mental health needs met, women's health needs met, etc. We are in different work groups based on the population that is being served. And so there's an adult work group, pediatrics work group, maternal health work group, behavioral health and geriatrics work group. And they're all identifying different priorities, more at the systems level, like how do you break down these barriers and kind of move things forward in this space. And so Monique has been plugged into that space as well, and has presented as well. So we'll definitely say to continue that conversation moving forward for sure.
Thank you so much. I was typing this, but I'll go ahead and say it. No, I already told you thank you for inviting us to that table. I do want to say that I do feel like the coalition members' voices will likely be more valuable there than mine. And so I want to at least share that with them if that's okay. Because I'd like them to have an opportunity to be at the table. Like I know that I came, you allowed me to introduce the MBHC, let people there know about it. And that's also how we've gotten connected to 211, which that conversation came up about, the two different situations that turned out very differently, and the lack of I don't know what the word is right now, but just really how it's not working necessarily for everyone. And so I finally got in touch with the person there because of you all, and she's going to plug us into the group of people that does this work. They make different decisions and see how we can work together. So that was great. And I know that also we got connected to, I can't think of it right now, I'm sorry, but I know there's the Missouri Primary Care Association, Missouri Hospital Association, but there's another hospital system that is across different regions, and we were plugged in with them as well so that they can support us. So that was great. But I just think now that's our work, is to kind of continue to make sure we foster those relationships. We see where, we can plug in even further in those areas and bring them in to address the gaps that we're seeing and the challenges. But I think that we also need to have these voices at the table, because they're doing it every day. And there are things that, again, I'm not going to think of, and I don't think I'm the best representative. I'm still going to be staying and engaged and be at the meetings, because it's invaluable to be there. But I feel like their voices are going to really bring a lot of guidance to this work. And I do love that you all, like we talked about social determinants, like you all are literally touching all of this. And there are some challenges yesterday that were brought up too, such as what's going on with like different FQHCs, federally qualified health centers, and the transition of people from hospitals to their care, and that there are some issues because the if I'm not mistaken, it's that when there's billing taking place, it's focusing on the provider, the actual doctor, and there's information that can't be accessed. And I don't know if there are challenges that you all experience as well. So that's why your voices need to be at the table across the state. But they're saying that's an issue, and they really would like it to be that the actual healthcare facility is listed instead of just one provider, because they may no longer see that person. They need more flexibility of who they see and things like that. So that's something, again, I wouldn't have thought of, but you all can speak to from your own experience on a regular basis. And then, is there anything I'm missing, Tanisha, in the?
In the chat? No.
No? Okay.
Jesse was just responding to yeah.
Thank you. Okay, so then as I look at if there's anything else you all have, jump in at any time. This is not like a scripted thing. You can jump in wherever you want. And we're going to take everything that you shared with us and make sure that we incorporate that into our plan that we're going to submit to them for the coalition work. Oh, and so one thing that this just came to me yesterday from MFH, and we can talk about this a little bit. We don't have to, we may not come to a final decision. I don't know. But when you all think about the community taking this over, because the next 2 years, our thought was that we're gonna, hear from you all what you know you need as far as training, capacity building, any other support, and put that, implement that. And eventually after that 2 years, we're looking at this being led by someone. It might be an organization, it may be an organization and an individual, it may, whatever it is that makes sense for your community. You all would take this over and you'd lead in each of your regions. However, we also want to know like what type of governance would make sense. Like, so the structure for the coalition, what do you all feel makes the most sense? Because like right now, yes, I know we are kind of leading this work, but that's definitely not how it should be in reality, as we're thinking about moving forward. So what do you all feel like the right structure would be when you think about that, if you have an idea about it at this point? Like, should it be go ahead. Yeah.
Oh, and this may be a little bit off topic, or rogue, and I don't have an exact fix idea for this, but and this is Tracy Graybill, by the way, and I'm in the urban west region. Sorry, the cat is stepping all over the laptop. Urban west region of which is Kansas City, Jackson, Clay, and Platte counties. And we're a big metropolitan area, but it blows my mind sometimes about how much is not happening here in terms of coming together for certain health issues. A lot of things are quite fragmented and siloed. And so my idea, I think, for breast health, and I can't really find anybody that's addressing it here in our area, as a coalition or as something that's come together to address it. And so my idea would be here in our region, at least, that we would have a like maybe a smaller offshoot coalition, of a larger statewide thing, something like that.
Yeah, that's something we said we really wanted to make sure that we did from the beginning, was have those like regional breast health coalitions. I know I was like, oh, well, let's take this off of the table, because again, we learned about those community health coalitions, but perhaps we joined that and we still, I don't know. We have to see how it makes sense to establish something
Yeah.
separate, because I feel like we're coming into communities, and if they already have something established, we should join that. I don't want us to just
Right.
Yeah.
And maybe it's just that people don't know, that there are these coalitions, and so it's maybe making it clearer that this is, um, I don't know. I just find a lot of fragmentation here. It kind of surprises me for a larger city and a larger metro area that we would be sort of scattered like this all over. And it's not just breast health; it's a lot of other health issues that don't seem to be. There doesn't seem to be one keeping place for people to go to talk about it and come together. So anyway,
No, that's invaluable feedback, actually. I'm gonna make sure we include that. Because I think that's important to go, like, to be included in this plan, is
yeah,
that, yes, the background of this is that the conversations aren't happening because it shows that there is a need. We're not just showing up because it's that this isn't happening. And the fact that
right,
you're saying it's not happening is, extremely helpful and
yeah,
yeah, very
yeah.
telling.
Yeah, and I think some of it might also be because, our at least in Kansas City, it spreads across state lines. And so sometimes things are happening on the Kansas side that are affecting the Missouri side. It's hard. It's hard. You guys
It's
get
not
that in St.
siloed.
Louis as well, but yeah,
It's
yeah,
not siloed like they make it seem like it's not like exactly. I mean, like, we're right there next to each other, so it can't not impact us. Like that just doesn't make sense at all.
right, exactly.
Like St. Louis City and St. Louis County, we're right next to each other. So
Yeah, exactly, exactly. So
I'm looking in the comment section too, and oh, I like that option. Chiquita, you said that first, if there's a way for each region to become a registered coalition, someone to lead each region and leadership from each coalition. That would be
And
I
when I
think
say leadership, sort of like a structure of leadership in the way that you have someone who is, you know, I don't know if it would be a president or some other role or a regional lead, but someone that's kind of corralling the people and the organizations and leading the discussion, but also someone, if it becomes a registered coalition in a way, they can also accept funds to support their activities. And then those activities can be reported upon as if it's like a mini grant. And I know that so I moved here from Mississippi, and when I lived there, um, I bring with me a little bit of experience working from the Comp Cancer Control department. And overseeing that department, we had regional coalitions that were set up, but those regional coalitions had to either be a 501c3 or some sort of entity that could be fiduciary responsible organizations who could accept some funds, and that may have been $5,000 or a small amount, but a way to help support regional activities that were happening. Because as you know, all regions are not created equal, and there may be less capacity. And with public health funding, there's very little funding for these activities to take place. And then you have a way that people could report back on the activities that are happening, whether or not there were screenings, whether or not there were prevention or educational events, whether or not there was a conference or connecting people to I'm sorry, federally qualified or rural health centers. Uh, we use patient navigators in the way that I see a lot of community health workers being used here in Missouri. And the good thing about community health workers in Missouri is that many of them get paid. And I didn't see that in Mississippi. So that's a huge difference.
And you know what? That's great information because actually the the Community Health Worker Coalition was established just a few years ago through some work, through a grant that separate from this. In my role as Mosaic Beginnings, we were able to get a grant. It was during COVID, but we were able to get a grant for St. Louis County, and in there, it was included that this Community Health Worker Coalition would be started. And so since they got that funding, that has been established and people are getting certified and all that. So there are people that were getting paid, but now more of them are able to. And we're still not, I think now they're working on how can we get this work billed, through insurance, because it's very important. And I do know United Healthcare is doing that now. So that's exciting. So we do have a model for that.
And they're the ones that are doing the hard work, so they should be compensated, right?
Absolutely.
And so, when you talk about equity and health equity, but I just wanted to make sure I completely understand. Are you working on an application, or are you working on a proposal to submit to Missouri Foundation for Health? Is that what?
Yes,
part
thank
of
you
the
for asking
discussion
that.
is?
Yes. So we drafted a proposal for them to consider. They knew that we were going to have a meeting to actually get you all's voices and make sure that we adjusted that to make sure it's meeting the need, and we're actually putting something in place that will make sense and be effective. And so, yes, we submitted that for their review, and then we're going to update it. That's where I actually was just typing this, and I'll still put it in the chat. But they are reviewing, they're saying that where we initially got the opportunity fund is usually much more flexible, and that's where they were able to provide funding for this work for the last almost 18 months. However, they are prioritizing certain things at this point, and so they're going to have a call for proposals in June. And so there's still, what I was told yesterday is that they are looking for funding in other places. It may be under advocacy, it may be somewhere else in their budget, because they do believe this work is necessary. They understand that we can't just throw this on people, and be like, hey, you guys ready to lead? They need support from Mosaic Beginnings. And then, yes, the communities are going to take this on as they should. And so they're looking at that. However, there may be a need for a 501c3 to apply for the grant funding and then contract with Mosaic Beginnings. If they can't find money for this for 2 years, maybe they may be able to extend it for a certain period of time. But yeah, if they can't find the money, it may make sense for a 501c3 to take that on. So we are definitely interested in that. Of course, we want to be intentional, because we want an organization that is going to be for everyone, that already has reach across the state of Missouri, and that literally is committed to this work and not their own self-interest, because that's happened before, and we don't want that again. So that's where we're at.
So is Mosaic Beginnings not a 501c3?
No, we're a consulting firm. We're not.
Okay.
I was like, well, I mean, I was like, I know of another organization that's small, very tiny, that is a 501c3, but I don't know that that is the appropriate organization to do this. So my plan is to reach out to those I think will have the right mentality and serve the coalition well. In that, and then I will ask them first, because I need to know if they feel like they have the capacity and are interested in doing it. But then we also will be bringing that back to the coalition to say, hey, are you all comfortable with this? Because that's important as well. I might think it's a good fit and the coalition may not. That's anything else you're thinking of, Chiquita? No? Okay.
I have lots of thoughts, but never
Well,
mind. I mean,
No, I mean, if you have something, you're welcome to share it here. Also, we can make sure that we set up time and we have a conversation too. I'm happy to do that. And if you send your thoughts via email, it may be that it's not even just me to talk to. There may be some other members of our team that'll be helpful as well.
yeah, I'm still learning the landscape. And so, today I'm just here to listen and learn as much as I possibly can and just see how we might be able to support the efforts or strengthen your application now that I know that you're applying. So
Thank you so much.
If you win, we all win, right?
That's the whole thing. Like, honestly, it keeps me up at night. Like, I could cry because it matters so much to me. I believe in everything that's being done. And, the only benefit I get from this is knowing that we're making an impact. And I know that I'm thankful to have a team that feels that way about this. Like, they're amazing and their hearts are in the right place. They're committed as well. And so that's the only thing when we talk as a team, that's what comes up is you all and what matters to you and how we can make sure that we're honoring your voice and the work that you are doing. And so yeah, like that's exactly it. When I think about it, I'm like, wait, if this happens or doesn't happen, who does
Yeah.
it impact? And that's a heavy weight, but it's one I'm willing to carry. I know our team is willing to carry so that I mean, they've spent over the last few weeks, they have spent a lot of hours on this because they just knew that it was important and they wanted to make sure that we represented as best we could for you all.
The biggest challenge that I see is just like Tracy said, things are just so fragmented, and people are working in their own silos, and there may not be as many conversations in certain parts of the state around these topics.
I agree completely. And that's something that we are working on. That's why I think like number one, this coalition is so helpful and beneficial because this is bringing people together from across all these regions because each region can learn from each other. And we saw that happen in a couple of our meetings where it's like, oh, well, this is a challenge we're having. And another region is like, well, this is what we've done. It may work for your region as well. And then also by people sharing the gaps that existed and the challenges, having the like Missouri Hospital Association, the Missouri Primary Care Association, the other hospital systems, 211, and then on here we have and then Missouri Cancer Consortium. I feel like those are starting to help us address. It's starting. It's not completed, but it's starting to help us address those challenges because that's necessary. I do see that there was also a comment about the coalitions having the opportunity. You just put that in there for to apply for funds and submit action or activity plans. And in the plan that we developed, I did fail to mention that we talked about working with you all to apply for funding because our team also has people who are certified, trained grant writers and grant reviewers. And so it makes sense to help support applying for funding during that next 2 years. And then also what we are hoping is that after that, we would have another hopefully a year. We said 6 months to a year, but hopefully a year to continue to, we would step back and then the regions would be leading, but we could still assist in applying for funding. So I do think that makes a lot of sense. And I see, Basmeen, you said partner with the Breakfast Club for their meeting every third Saturday. Oh, you brought people across. I didn't know about across the country. I do know about the Breakfast Club. I love Cheryl. But yes, I like that idea as well. Thank you. And we will make sure that we're intentional about including that. And Valita's Valita, you've always been amazing. And that I say it in every space that I'm in. I thank you. And so I think plug in wherever is necessary. Of course, we'll be intentional if there is something we think of, but really based on your expertise and everyone on this call's expertise, we just need you all to look at to think about what you'd like to see, just as you're doing here and sharing in the comments or on this call. But also when you look at the document, if you see that maybe even if you disagree with something, you don't think it's appropriate, please say it. We're not offended. We want to know. So if you look at that and you see something doesn't make sense, remove it. Like, just let us know, hey, I don't think this is going to work. And this is why. And so that's where we can get the most help after this meeting is you looking at the document and telling us what makes sense and what doesn't. So I think make sure, I know there's other comments. Let me look at those and then we'll go through the document. Oh, thank you, Chiquita. Oh, Reve, I want you to jump in too, if you don't mind.
A question, as far as the initiative, where are you struggling the most? Because I know St. Louis, you pretty much are or over, I know that you have a good resources there to help with your with this process. I know in the Southeast Missouri region, we can hold it good. Where other areas are you, not as strong that you're trying to establish your base? I can't hear you.
I'm sorry. Thank you. I want to say thank you, Jesse, for being here. I see you have to leave. Thank you for your collaboration and your support. Yeah, 'cause without Jesse, we wouldn't have some connections. I'm very grateful. Yeah, so that's a hard question. So first I want to say Tanisha put a document here for you all to be able to, she put the document there for you guys to be able to comment on, that we're referring to. You know what? I probably need to make you all editors. And then I'm going to answer your question, I promise. Sorry, I just want to make sure I do that. That way you're not just viewing it, you can actually make some changes and suggestions. Okay, now you guys are able to make suggestions in that document. So I would say, I don't know that I can fully answer that question, because I would say all the other rural communities, honestly, because the majority of them have just joined the conversation. They weren't a part of this. And so their representation, obviously is extremely important and was missing. And so I think that's important. I think in the area of understanding policy-wise what we need is important. And I think getting a better picture, not even I think, I know that getting a better picture of what's happening in each region and what the challenges are is what's going to be most important. We've heard things consistently, whether it is St. Louis or Kansas City or Joplin or what, all these, like, it can be, a lot of the smaller areas, some things are just similar across the board. Then there's these nuances that exist in each region because of how they are set up and who the players are that are at the table in their community that are making an impact, and the policies that are in place. And so we want to account for that as well. So I would say that there are quite a bit of challenges that we're still missing the mark on, because we just don't know they exist. And that's what we want to get a better idea of.
One more question, and I
Mhm.
understand that it's been a lot of changes, but you recall in the beginning that you were around the table and then it was shut down, then it came back up with you. And during that period of time, there was a lot of data gathered. There was a lot of people from the health departments from Southwest Missouri in the Springfield area. It was a gentleman. I mean, he had so much information. Do you have access to any of that, or is that still, because we did so much work during that period of time, and I know you recall. So to make it easier for you, um, and I've noticed that a lot of those partners are not around the table. Is there any way that we can like reactivate them, or see where they are and kind of help?
Absolutely. And I wouldn't say they're not at the table. I would say they may not have been able to make some of the meetings, but I think they still are. But I would like us to be intentional, to your point, about re-engaging them at a more at a deeper level. And we did
Mm.
capture that information. That's actually what we used. So what she's referring to, let me also level set for people. There was an organization that had a grant, and this work fell under their entity. And uh, the representation or the support of the coalition was self-serving instead of being intentional about really allowing these voices to come. So yes, we were brought in by Melanie Gowdy, who's amazing, to help with that work. But then after we learned that information, that it wasn't really serving you all, my team chose to pull out, because we don't want to be a part of something that gives the facade of we're listening to you and we're serving when we're not. And so we were very transparent with the coalition. We shared via email, I shared via email what was going on, and not knowing whether we would get funding or not to do this work, I said, we can't show up in front of you all and lie to your faces. So thankfully, MFH, I reached out to them, and I know that's not what they stand for either. And then shared that with them, and our team came together, put together a proposal, and then that's how we got where we are now. So that's what she's referring to. During that time, when we came together, it was October 2022. We got a lot of valuable information from people, and then we used that information for us to be able to level set when we started officially in January 2024 with our first meeting. So we do have that information that we captured all of that, and we built upon that information. I do feel like there's some entities that have said, hey, we're happy to share data with you, and some have, some haven't, and we will just be intentional about reaching back out and making sure that, that's, I think, an ask that we need to do in general to the coalition, but also I do at this moment, I'd have to look back at the list right now. I know we don't have time for that. I'd have to look at the list, but I think that I'd like to know, I see the man's face. I cannot think of his name. I know who you're talking about. Do you want to say his name, or you want to send that to me privately? It's up
No,
to you.
I can't, I don't
You
remember
don't
his name, but I know that he was doing some dynamic work, and I just think he would be awesome
Mhm.
to be here around the, around the table. Um, I don't.
Okay, that's okay. We can look back because I do know we have all of that. So I can look back, and I will promise you that we'll be intentional about reaching out to him.
Mhm.
Because you're right. I mean, he was actually the person, I believe, that when I mentioned there was a region that was already doing some work, like there was an issue around um breast like mammograms. And so as I
Yep.
said, yeah, he was the one who's like, oh, we're using like imaging centers and we're doing this and blah blah blah.
Yep.
That helps another region. So I
And
absolutely. Mhm.
he was very interested in policy. Yep.
Yes. And we need that. And I do want to make sure I get to that piece too, because that's important. Um, I think overarchingly, so I'm seeing everything people are sharing. I just want to make sure I don't care about not sticking to like certain points on the agenda. It's more important that we have the conversations that we're having. Um, I do want to say I know that without me even speaking to policy specifically yet, implementation, everything. Right now, we know the climate. I'm a realist. We know the climate. We know that things are ever changing. We know that things are in a frenzy, and like so some things we've had to be reactive to. And I know you all have had to be reactive to that. I also know that this is it's a huge part of what's changing, what we're going to submit at the end of this contract, because we're looking at how do we support based on the fact that we don't know what's going to happen tomorrow, today, we could be surprised at 3 p.m. Who knows, with something new. And it's impacting us in every single way. And so looking at that, I want to know if what challenges potentially this has created for you all that you want to make sure we're intentional about addressing as well. Yes, policy wise, but also aside from just policy, like what are things that you all think we need to be thinking about? What kind of support do we need to make sure that we're providing? Because I mean, we got 4 years to go. What do you all feel like you would need most to help navigate that over these next couple of years, so that we can make sure we have people in place to do that? Because you can't do it all. But we can support you in the work you're doing by making sure we're looking into information, making connections, anything else, trainings, whatever it is. I mean, I don't know that trainings is really the things. I don't think there is a training, but I think that maybe some connections and some additional support would be helpful. Um, if you all can tell us what any of that is. And even if you can't tell us what support you need, if you can speak to the challenges, we can figure out how to support. So I want to say that too. Has anyone been impacted recently, or do you have certain concerns about things based on what you're seeing that may be impacted that you'd like us to consider as well?
Um, I have some concerns that I'm not, pretty sure, as you had stated, things are changing right before our eyes. But the changes in Medicare and Medicaid, and we can fine tune as far as the screening, for women. consider we're talking about, breast cancer, but, we can go deeper than that. So what will they pay for? We just don't know. And to connect with services that will cater to the needs of those people and make them accessible, especially in rural America. Well, in my region, I only can speak on my region. So that's really where I have a lot of concerns about.
That's super helpful. I think other regions would likely agree. I mean, yeah, I think that's great. But I thank you for that, and we'll make sure that that's something we're considering. Okay, Chiquita said she agrees as well. I think that that's something that we definitely need to include and consider as we're thinking about ways that we can provide support. So I want to look at the existing partners who may be able to be helpful in that aspect, and then maybe partners potentially that we haven't even considered. And also that to that point, it might be helpful in each of your regions if you're thinking, well, hey, this is an organization that has the opportunity to like make a difference, and then we can help you all. I mean, we could advocate, but I feel like it's really about you all. They're there in the region that they actually know and care about. We can support you all in how to advocate for that change. So providing the language, providing the approach, providing all of that to see how we can make a difference. I think that'll be it. So if we know the organizations that exist in your region, what they're doing and how they could make a difference, then we can support you all in how to approach them and get their support as well. In addition to the other things that I mentioned too. I think we do need to also do more at the state level, talking with people. And so utilizing what you just shared and anything else that you guys share, I want us to be intentional about reaching out to them. So it's going to take a state and regional level approach, and that's where we come in. We know you all don't have the time to do all of that. It's not that you don't have the skill or the will, it's just the time. And so that's why we're here to make that happen to the best of our ability and go from there. Anyone else have thoughts on like things that, as you're seeing what's happening, that are concerning you, areas where you'd welcome support?
It's not a concern really, but I'm a major theme that I'm really hearing, and this is across all of my healthcare priorities that I have, because obesity is also a priority that I've chosen to focus on for our region. But something that I'm hearing a lot related to breast health is lack of access to is food insecurity and nutrition insecurity, and really lack of access to fresh produce. And so, I think along those lines, I guess my question is, how much do we plan to focus on the upstream of breast health? And how has anybody given any thought to that? And I'm sorry for all of my weird rogue questions. I'm just
No, don't stop apologizing.
I have
Thank you
many thoughts.
And I love many thoughts, and I love all the questions, honestly, because that's what we need.
Yeah.
So thank you. And I just want to make sure for the entire group, I clarify what you mean by upstream.
Oh, upstream. I'm sorry. The social determinants of health, and the social determinants that can affect breast cancer.
Yes.
And I am discovering how important it is to people in my region to have access to food, and the way that can affect breast health.
Got it. No, that's helpful. So that's always been our focus because there are several of us who are public health professionals. So that's why, I mentioned that we are not operating in silo. Like people tend to say breast health, and they're solely focused on people that provide care for women who have been impacted by breast cancer. And that's missing the mark on so many levels. Like that's important, but we're missing the mark. So
Yes.
So we're focused on all of that, whether it's, like I said, housing, as you mentioned, nutrition, we're looking at mental health, employment, education, all of those things that impact people. because we're one person
Yeah.
impacted by, yes. And
Yes.
we know that one of the things is healthy foods, to your point.
Yeah.
But if we don't have access, that's an issue. So that has always been a focus of our work. I cannot speak to what's going on maybe in the different regions around that, but I think that's something that we need to be more intentional about assessing, like what exists.
Yes.
Mhm.
Yeah, I feel like maybe, like I said, this has been a major theme, the food insecurity and specifically nutrition insecurity.
Mhm.
Because you can have enough money for food and still be eating red dye all day long. I don't know,
Mhm.
Um, it is maybe knowing the needs. How do I put this? I mean, I know what needs are because I'm hearing, right, the food insecurity, but really getting down into the nitty gritty and hearing from people in the community about what they feel like they need related to health, breast health, because I just think that would be super useful.
I love that. We will make sure that that is something that we include and we do across the.
Right.
So I do think like, yeah, we've had that as a focus, but I feel like we can definitely be more intentional than we've been about that. So we've kind of put it out there in a more broad sense instead of, and we've asked like, we want to be at tables where this is happening and have people like that at this table, but we haven't said, hey, in your region, what's going on for these specific things so that we
Yeah.
can be knowledgeable about that. So I thank you. That's what I'm saying. Don't apologize for asking anything. That is helping us do better on behalf
Right.
of the
Like,
coalition. Mhm.
I mean, and I would be happy. I love a good focus group, but I would be happy to help with that, to bring people together in my region anyway, to get people together to talk about it.
Reve, you hear that, right? Reve is our lead evaluator.
Oh,
Yeah, she's
yes, I love it. So yeah. Anyway,
I love that idea. I love that on a regional level. And so I think
yes,
that's a call to action for us.
yeah,
And then I also love it even in us asking the coalition as a whole.
yeah,
So I think we take both approaches. I think it'll be more effective, obviously, regionally, where it's like people saying, hey, let's bring people together that we have connections to and we know this will be effective with. Um, that's the most that's the best way to go about it. But I do think that at the state level, we should reach out to the coalition. I'll yield to Ms. Rive for that. Yes. And so with that said, I know we only have a little bit of time left. This has been so helpful. Like you guys, I'm be honest, I was freaking out because like I sent them the wrong document. I thought they had 10 days and they didn't. And so I felt terrible about this. And so, but I feel like this conversation is extremely helpful and productive in propelling this work forward. And I'm so grateful to you all. I would like to make sure that next I ask I'm gonna say two names because then you guys can just kind of like, do what you want to do. Reve and Mary. So Reve is, like I said, lead on evaluation. And then Mary is our communications specialist. I'll say that for lack of better words, because like our guru, I'll say that. So I would like you guys to ask any questions that you would like to. Oh, Chiquita was like, oh, so yes, our team, I'm sorry, Chiquita. Mary, we probably should have pulled up that page on the website. Tanisha, if you get a chance. So Tanisha keeps us together. I just want y'all to know that for sure. Tanisha, if you don't mind sharing the link to the page on the website that has our team. We have on this call, we have Tanisha. She's our project manager. Again, she keeps us together. We also have DeMarco, who is our policy expert. Amarachi, even though she's not here anymore, she had some other things going on and just really became very busy. And so that's the only reason she's moved on, but she has been super essential to the policy work that we've done thus far as well. And then we have Reve, who is our lead evaluator, and then Mary, who is responsible for communications. And she developed the website, she does our social media, all of that. Sloan is also a lead facilitator, but y'all, the ones who've been here know when Sloan she had her daughter had a performance today. So, we choose family all the time. her daughter had a performance. And so she, we don't have DeMarco on there. Sorry, DeMarco. We love you though. DeMarco is like policy expert guru. But Sloan she like in the meeting, she will set the tone. We're doing our breathing exercises. She's done assessments on personality as an individual, but also in your different spaces you work in, and has identified strengths that people didn't even know they had. And it's like, yep, see, you are a leader. You might think this is your role, but you also have these other skills that are invaluable to the coalition and to your organization. And then Atia has recently joined our team. And so she's serving in a variety of capacities. She's supporting a lot of things. So project management, she's supporting the policy work, evaluation, anything. Atia, I'm sure I'm going to miss something. Yeah, she's supporting a lot of the things that we're doing and making sure that we are able to move this work forward effectively and efficiently. So thank you to Nisha for sharing that. I appreciate it. So yes, Reve and Mary, have at it.
Thank you, Monique. Mary, if it's okay with you, I'm going to defer to you first because I know that I will be a time suck. But if I know how much time I'm working with, then that will be helpful. So if you could go first, and then because I drafted a lot of questions and I just want to be very mindful of the time that we have. And so I will cede the floor to you and navigate whatever time is remaining.
Okay, well, I'll keep it really brief. I think the biggest thing we've been talking about as a team is how we can do better as far as effectively communicating. So we do have the website up. We have been posting on social media, but just doing this for a while, social media is only one part of the piece because it can only go so far. So we've been really like talking about how we can do, I guess, equip you guys better with sharing information that's pertinent to your circles. So that, I think we've mentioned about, things just being everybody working in silo and things not really coming together. So how do you feel that we can do better? I know we mentioned, doing better with the newsletter, but what can we include in those newsletters that would be helpful so that you can, I guess, bring more people to the table, and that we can start communicating so we can start really getting the message out. So really looking for suggestions on how we can, empower you guys to do that better.
Will you also share what your thoughts are, Mary, on how this would be, like how we could potentially be most effective with communication?
Oh, yeah. So we've talked about doing highlights of, partners that we already are working with. So we're already working on how to better do that. We've talked about highlighting more things on the website. We already have events on the website, but I guess how can we do better with getting you guys to give us the information to put on the website. So we talked about doing a form, but I don't know if that's the most effective ways. So I guess how would y'all feel, I guess, comfortable with giving us the information on partners that we can highlight, people who are already doing the work that we can, start putting that out better so that people will know what is already going on and how they can plug in. Does that make sense?
I love that. Thank you. Any thoughts, you all? Like, do you all feel like, so I would say this at a coalition level, do you all feel like the newsletter is maybe the best newsletter? I don't know, maybe email, I'm not sure, is the best way to make sure we communicate to you all. And then I would ask, is there a better way at the regional level for us to be able to communicate? Because there might be something in your region that's like, oh, if you all get in here or whatever, then that's how we're going to engage more people. And it's okay if you don't have an answer right now, but if you do, we'd love to hear it.
Yeah, and if not, you can always email us. We're still trying to do better. So even if you can't think of anything offhand, we're always open to suggestions.
That's awesome. Thank you, Mary. I appreciate that. I want to acknowledge too, like policy is super important for so many reasons because that promotes long-term change. I know that obviously time is getting away from us, so we might not get to that. I did put a question in the chat that I would ask you guys to respond to, please. If there is something you can think of, it doesn't, there's no right or wrong answer, anything. If you all can just give us something, that'll help. And we can also follow up too, with you as well. And then I'm gonna yield to you, Reve, at this point.
Thanks, Monique. So the very first question, because at the core of this, we want to make sure that this work is sustainable, right? And just thinking about evaluation and evaluation capacity, the question that I'm going to ask everyone to just respond in the chat. If you don't feel like putting your business in the streets, you can directly message me instead of sharing it with everyone. But I would need to know, do you have evaluation capacity either in your organization or in your region? And so that can be broad. Like I have somebody who can do data collection and data entry, but analyses is beyond our scope. So if you could write a yes or no to that question in the chat, either to the group or directly to me. If you do not feel like letting everyone know your business on this call, but I just need to know what I am working with as I'm developing sustainability tools and toolkits, how I need to frame it based on capacity for the different regions is my first question. My second question is around success. And when we are thinking, thank you, when we are thinking long-term at the end of this 18 months, what we hope to be an 18-month contract, through the lens of either your organization or your region, how would you define success? What would need to happen in your region, in your organization to say that the last 18 months of coalition participation on behalf of my region or on behalf of my organization and the folks that I represent.
Can you say that again? I don't know if it cut out for other people. It cut out for me. It wasn't you. I think it's my internet, but the last thing you just said. Will you say that again?
Yeah. So through the lens, I'm just going to repeat the entire sentence because I don't know exactly what the end was. But through the lens of either your organization or your region, how would you define success at the end of 18 months? That if you look back and you said, based on my participation, the results or the fruits of my effort are successful because, and to give you, I heard some of it already discussed by different folks. I think I heard something around food security, right? Making sure that we are acknowledging whole woman health. It's not just breast health. So food security, I heard. I think I also heard, I may have heard on this call or conflating with other calls, actually lowering the age of care through Show Me Healthy Women, like just thinking through the lens of your organization or your region, what would success look like? And I'm going to pause there because that's a very broad question, and it can be difficult to sometimes answer when you're in the weeds of your day-to-day. So I am going to just pause for just a moment. You can either come off mute or you can put it in the chat, or you can also send it directly to me. What comes up for you?
Reve, will you put your email in the chat, please?
Absolutely.
Thank you.
And the follow-up question that I have to that question is thinking about measurement, right? And so if we have, I'm using the example that I heard, I think most recently around food security. And so if we're saying that I would measure success such that women or folks in my community have access to secure food. Food insecurity is reduced by X%. And we would know that because women coming in are not talking about maybe access to food. They are coming in and ready to actually talk about other health factors. There aren't, I'm sorry, I'm looking at Monique's face, but I think you're reading it.
No, don't look at my face. Sorry, I was reading the chat and trying to respond to people. Sorry.
The funny part is I have a very reactive face too. My reading and thinking face is a mad face. So I have the nerve to be asking somebody else.
I'm glad you said something though, so I can clarify. No, I'm just looking at the chat and responding to people. You are phenomenal. You're amazing. We're good.
I have the nerve because I have a reactive face. So those are one is a follow-up question to the first, is really thinking about success. What do you all want to get out of these next 18 months? And we'll flesh that out. I know some thoughts and feelings and emotions might perk up or percolate as you are reading the document that Monique shared, but we want to level set. We have all kinds of ideas, right? Especially me as an evaluator, have ideas around what success would look like. But success means different things to different people. That's similar to a love language. There are people react and respond to success differently, and you have different needs in your regions. So very, very important that we level set so that we understand for this region, for this organization, this is what success would look like. And then we can come together as a coalition and define that more broadly to make sure that it is relevant, but also slightly tailored to meet the needs of the entire coalition. Because if not, then we're all over the place and folks will not feel like we accomplished anything.
I,
So
I have a suggestion, Reve. I know that Sarah Chavez, I may have mispronounced her name, but Sarah mentioned earlier that the state was working on, or the statewide consortium, was working on a statewide plan, right? Maybe that could be a starting point, to either collaborate with them as they are developing that plan and take out the parts of that plan that apply to different regions and go from there and and change maybe some of the outcomes and or percentages so that it's relevant to that particular region. And the only reason why I'm suggesting that, because even though and Tracy mentioned this earlier with the fragmentation of our state, if we start at some central point, then we can take that information and make it more relevant to the different regions and or communities so that then it will resonate with that particular region and community. But I think it's important for us to start at a central point, and I hate for you to, I know that you want to be able to demonstrate in this application, okay, this is what success looks like. Maybe I don't know what timeline you're on, but if they have gotten to the point where their plan is something that you can work from, otherwise you will have to create your own, right? So I just wanted to say that, so that we are uh doing similar work and not duplicating. Do you know what I mean? Like, so that we can complement each other.
absolutely, so that there is alignment. So I was thinking bottom up, you're thinking top down, and either option works. So I love that. And thank you so much. That is helpful. And I want to check in with the group because I'm not the decision maker at all in any capacity. So checking in with everybody else on the call. How do folks feel about that being the starting point? And it can simply be the starting point because to Shaquita's point, I pronounced your name correctly, correct?
It's Chiquita, but that's okay. I
Chiquita.
understand.
Okay, I'm very particular about the way people pronounce my name, so I try to be very cognizant of that. But to Shakita's point, goodness gracious, where was I going with that? So caught up on people's
The-
names. Thank you. No, but to Shakita's point, it gives us a starting place. So even if we say this doesn't work for us, we are starting with something. And so it's easier, completely agree, Shakita, to be reactive to something instead of building something from scratch. And so
And
go ahead.
and maybe that plan is probably, I expect, I would hope, my fingers are crossed, that that plan that we're talking about is more expansive, right? And it focuses on different cancers. And while we're talking about breast health, right? Not just breast cancer, we're talking about breast health. Um, we might be able to derive from that at least some pieces, because again, we want to be uh, thoughtful and intentional about addressing the other health components that contribute to positive breast health outcomes.
Absolutely. Absolutely. Okay. This is good. So it gives us a starting point. I also want to be cognizant and say that there are 4 minutes left. So Monique, I have marching orders or at least something to start with. And then we will check in during our next meeting, which is about a month from now. And we can also make another decision to say whether or not this is the framework. Hopefully, uh, it's far along that we can align or say this doesn't work. We get to think about something else. But I'll have that prepared and ready to go for folks to react to ahead of next month's meeting so that we can actually use time during our next meeting to flesh it out or make some decisions.
I love that. Thank you, Reve. I appreciate it. The dialogue's been amazing. Like, this has been such a great meeting, and I feel like we have so many takeaways here. If someone did privately message you, if you would copy that information, because I know we can share a chat of like the general stuff, but not the other. So just make sure you have that, because I would hate to miss any of that info. And I don't need to see directly who said anything, but just for your own reference. But I also want to say that yes, we kept so typically we meet quarterly. We kept next month's meeting because we know there's still more work to be done. And so we are doing that. That's on April 25th. And so we're still gonna meet then. I believe that was the date. And so we're still gonna meet then. But I also want to say that our team is going to meet Wednesday, and we're going to take the information that you all have shared with us. We're going to have a conversation and have a working meeting where we begin implementing a lot of this into that plan so that we can share that with MFH. And then we will share the updated plan with you all to make sure that it is accurate and it reflects what you all are thinking. And then so that's an important next step. I do want to allow space. And again, I sent DeMarco a private message, but I apologize because I know we didn't get to talk about policy a lot, and that's important in this work. I'd love for you guys to send anything related to that, and otherwise, anything we've discussed here, please email us with that information. Like if you have thoughts, you have questions, whatever, email that. But also know that if you'd like to meet, I'm so happy to meet with you. Just send an email about wanting to meet and what it is that you'd like to discuss. The only reason I say what it is you'd like to discuss is because I'd want you to make sure that if someone else from our team needs to be a part of that conversation, they're there. Because I don't have all the information and our knowledge. And so I want to be intentional about that. I do want to also allow space if you all have some additional thoughts. No one has to obviously stay on, but if you have additional thoughts that you'd like to share with us before and I want to make sure we capture that. So are there any remaining thoughts, any feedback, any next steps we need to be intentional about ensuring we put in place from your perspective? This meeting made my whole day, by the way. I just want you to know that. So, let's see what these messages. Okay.
I wanted to make a remark. And maybe this is because you all look so young and vibrant. It seems that
Oh, we're
I
young
might
and
be.
vibrant. Okay, thank you. I can't flip my throat for real, but I'm trying.
Yeah. It seems like I might be the elder in this group, and I'm so honored to be just even a part of these conversations. I'm a medical navigator for the community, and I always say I came to this work through my father, who was Dr. Alva Moore. He was the first Black cardiologist in St. Louis, coming to Homer G in 1937. So I've seen a level of healthcare that has only been eroded in the last 60 years. And remembering that we do holistic healthcare, that what I've seen in community is taking care of one another on all levels, whether that's bartering bartering in exchange, making sure that food is there, making sure that housing and safety So if you all have any elders, because my father came along in the era of the Jim Crow segregation where we didn't have access to any type of Western medical information. And we managed through that. So we're really just moving through regressive policies that are rolling back everything I've seen happen in the last 60 years of my life. But what I want to bring forward in that is our resilience. We made it through before when we were denied access. We will make it through it now. So whatever you have to do, if that's through a faith base, if that's talking with your elders, if that's imagining on the horizon circle, because if we stay rooted in this madness that has been created for us, let's plant the seeds for what we want to see and move toward that rather than feel there are restrictions. And on that note, Monique, I must tell you, I so appreciated your voice at the community meeting
Thank
because
you.
there are difficult things that need to be said. We can't be silent on these things anymore. Find as honest and respectful way to address it, but we can't remain silent. It's time to get up and speak and do and say if you don't want to come along, then that's all right. We will let our vibe found our tribe, and we will do what needs to be done. So it fills my heart that, you know, y'all young people, young people are charting a way forward on a path that has no map. And we'll
That
get
means
it done.
thank you. Is that the one with Dr. Everline?
Yes, it was. I had wanted to be there in person and couldn't make it because of some of my health challenges, but yes, ma'am. Yes, ma'am, because he didn't and they don't respond when we say specifically what it is that's needed. And we know they have the resources. That's where all the resources are. Let's not be confused. Let's just say it out loud. You know, if you don't want to answer that question, that's not
Just say you don't want to
unusual.
answer it.
Right. You know, we've been down this road before, so we will go off and make our own. Also, I'm a member of the Farmers Union. Here in St. Louis, we have the All Hands on Deck, which offers free food pretty much every day of the week somewhere. You don't have to have any kind of documentation. You just show up with a bag and get your food. But as the administration, the current administration is destroying so much of what we thought we were trying to do with democracy, let us find ways that we can integrate, especially with the Black and Indigenous farmers. Let's see what we can do with farmers, especially in the rural areas, because we have urban farmers too. But let's connect these communities. Let's connect our circles of association and dispel all those disparities and other ways we have of thinking about one another to know we are human beings. So thank you, Monique.
I love that.
Excuse me, could it be possible for you to inbox that connection to the Farmers Union, please? I'm a small farmer and I really would like to get involved with that.
You can just look on Missouri Farmers and the Farmers Union, because now they have a women's coalition of women farmers, you know. So yeah, look them up, you know, locally and nationally. The Missouri Farmers are local, and the Farmers Union National. I have a lovely button that says FU for Farmers Union. So yeah,
There.
it's time we connect the real and the farmers and really encourage, if there's any way, if anybody has a little plot of land or if they have some containers, grow some stuff yourself. I know when I was coming up, you know, my folks always, everybody had some kind of little plot of something they were growing in the backyard, and grow what you can and exchange that to somebody else. So we can do this, y'all. You know, they just, you know, when they tried to destroy us, they didn't know we were seeds. So the genocidal attempts have been ineffective. This is
One tomato plant can feed a family.
that's right.
One tomato
And you can
plant
exchange
feed
that
a
with somebody
family.
else. Mm-hmm.
That's right.
And and grow what you eat, and let's find out about food is medicine. What foods really help people to assist with whatever their physical malady might be. Because like I said, we were in the herbs and spices and all of that. We were doing all of that before they developed all these chemicals that are derived from the natural elements. So be encouraged, y'all, because we gonna get it done and maybe lead a way to a whole new world. How about that? Wouldn't that be something?
I love it. I believe it. Thank you for the encouraging words, the reminder. Like we've overcome so much, um, over the years that we can also implement now. Because I'm looking, at all of that. I look at this from a standpoint of it's very reminiscent of COVID. It's just different reasons, and also the Great Depression, which we're being somewhat sent into. And I just thank you for that reminder. I'm definitely looking at our community as one that has traditionally come together and been able to survive and thrive. And I believe that we will be able to, as bad as things seem, we are able to overcome this. And thank you to your dad. I also thank you for the information about the farmers because that speaks to the nutrition conversation we had earlier. And I would ask if you would send us the information explicitly about what you shared, because you were like, it's is it something hands? I don't want to say it wrong. But it's mean.
All hands on deck.
All hands on deck. Yeah, if you can send that specifically, that
Okay.
will be really helpful.
Because they send out text messages every day to
Okay.
let you know where in the city they're offering a food share.
Okay, and we'll share that, and then we'll also share the other information that you mentioned too with the coalition so that people know. We'll share it on social media as well so that people know that's a resource because it's needed. So thank you. Okay, well, I think we are good then. We'll follow up. Our next steps are, like I said, our team is meeting Wednesday. We're going to incorporate the things that you all shared with us in the plan, and then we're going to share that plan with you. I know Revea is going to follow up with you about the evaluation aspect of things, incorporating, of course, what was shared here. And we'll look forward to your feedback. If there are other people you feel need to be apprised of this information, always feel free to forward the emails, but also please share their information with us so that we can make sure they're on our list. And on the website, there is an opportunity to say, oh, I want to join the coalition, and then we can capture your information that way as well. So I'm grateful to each of you. Like, I know you're all like, oh, thank you guys for this work. We're happy to support, but honestly, we can't do it without you. And so your voices are invaluable, and I'm excited about what's going to happen. I just believe this is going to make a tremendous impact. So thank you all for your time. I hope you have an amazing day. Follow up with us. Like I said, email us any thoughts. If you want to meet, let us know. We welcome it. There's no dumb question. There's no thought that's not important. We need you. So thank you. So, bye, you guys.